President-elect Donald Trump has nominated Robert F. Kennedy Jr. for Health and Human Services Secretary. The department oversees several agencies, including the Centers for Disease Control and Prevention and the Food and Drug Administration. NBC News correspondent Vaughn Hilliard has the latest on this controversial pick.
After teasing a potential administration role for weeks,
RFK Jr., he's going to help us on health and the health of women, and men, and children, and he is so good.
President-elect Trump selecting Robert F. Kennedy Jr. to be his next Secretary of Health and Human Services, writing, Americans have been crushed by the industrial food complex and drug companies who have engaged in deception, misinformation, and disinformation when it comes to public health. Kennedy is a former Democratic and independent presidential candidate who dropped out and endorsed Trump.
You want an America president who's going to make our country healthy again.
But he's faced criticism because of his history of vaccine skepticism, publicly espousing discredited assertions that vaccines cause autism. Vice President Harris slammed Trump for praising him.
He has indicated that the person who would be in charge of health care for the American people is someone who has routinely promoted junk science and crazy conspiracy theories.
Kennedy telling us last week that he would not block any vaccines.
I'm not going to take away anybody's vaccines. I've never been anti-vaccine.
You will not take any vaccine that is currently on the market.
I'm not. If vaccines are working for somebody, I'm not going to take them away.
During the campaign, Kennedy also made headlines when he said that 15 years ago, doctors told him he had a parasitic worm in his brain that died. Kennedy is a critic of U.S. healthcare policy who's advocated for big changes to food and drug regulation, writing last month, the FDA's war on public health is about to end, telling us he would eliminate parts of the FDA.
The nutrition departments at FDA that have to go, that are not doing their job. They're not protecting our kids.
That was NBC's Vaughn Hilliard with that report. Joining us now, former Obama White House advisor for health policy, vice provost for global initiatives at the University of Pennsylvania, Dr. Zeke Emanuel. Dr. Emanuel, thank you so much for being with us this morning. If we could just start with your reaction to Trump's nomination of Robert F. Kennedy Jr., and if he were to take that position, what sort of impact would it have on our nation's health?
Well, I think the man is unqualified for the job. He doesn't have management experience. He doesn't understand how science is done. He doesn't understand how the federal government evaluates various studies. He can't actually look at a research paper and look at the data and draw conclusions. And he's about to, they want to give him a $2 trillion department with 80,000 employees that oversees the NIH, the FDA, the CDC, as well as Medicare and Medicaid. That is a bad combination. I should say he does have some ideas that are worth pursuing, such as focusing on chronic illness. 85 to 90 cents of every dollar we spend on healthcare goes to chronic illness. We have to focus on them. They are our big problems, whether hypertension, cancer, diabetes, arthritis, and we have to get our arms around them. And he's right, to improve the nation's health, you have to attack chronic disease. He's also right that we've got to look at ultra-processed foods in the food chain and how they cause obesity in the country and stop that. And we have to get conflict of interest issues out of the review of drugs, devices, nutrition, etc. But then he goes on to vaccines, one of the greatest inventions humans have ever had, where we've saved hundreds of millions of people. It's estimated we've saved 154 million people from vaccines in just the last 50 years. In the United States alone, the childhood vaccines against hepatitis and pneumonia, we've saved 1.1 million people in the last 30 years. And he wants to get rid of them. He says he's not going to take them away from people, but he's going to not approve them. He's going to make sure the government doesn't certify them so that they can be reimbursed by insurance companies. And he's going to put a chill in the drug companies from investigating and doing research and development to develop new vaccines. This is right when we're facing a potential influenza pandemic with H5N1, and we need to develop new ways of making those vaccines. So I worry a lot about this appointment, as I do about a lot of other appointments. It's not a good moment for health, I think.
Zeke, it's Sean Heilman here. Let me just suggest the possibility that one of the ways in which we're all kind of getting this story a little bit wrong is by looking at all of these cabinet appointments and evaluating them on the basis of, is the person qualified to run the thing they're being asked to run? Most of these people are not qualified to run the thing they're being asked to run. You put someone like Pete Hegseth at the Pentagon, which is, employs 2.8 million people. 2.8 million people at the Pentagon. The man has never run anything bigger than a carpool. He's obviously unqualified to run it. And I think you would say the same thing about, as you just said, about Robert F. Kennedy Jr. and HHS. But what if the goal isn't to run it, and the goal is, in fact, to ruin it? And what this is about, taking the president and his ideological abettors at their word, is about the thorough deconstruction of the administrative state. They're trying to wreck the government, not run the government. If that were the goal, Bobby Kennedy might be uniquely qualified to do that in the world of HHS, because not only is he not able to run an organization this big, but he's a paragon of misinformation and disinformation about health, which is another kind of toxicity and poison that he may introduce into the system if he gets this job.
I think there's a lot of merit to that. And let me say, I think another way of looking at this is President Trump had a lot of bad appointments during his first administration. He had Zinke at Interior, he had Rick Perry at Energy, and several others. But he also had some strong appointments, and people like Jim Mattis at the Defense Department and Mark Esper at the Defense Department. And he had, you may not like Bill Barr, but he understood that he had to stand up to the president at some points. I think another way of looking at these appointments is these are not people who are going to resist Trump's whims and are going to say, no, there is a bright line. These things aren't constitutional. These things aren't legal, and I'm not going to do them. And I think these are appointments that are going to bend to his will. And that, I think, is extremely dangerous. And it's up to the Senate. They have an advise and consent role. And we have seen that a lot of senators on the Republican side are not quite comfortable. They elected Senator Thune, who's an institutionalist, and I hope he defends the prerogatives of the Senate here. These are not, as you point out, these aren't people who can actually constructively run their departments in the national interest. And that, there's no faster way to become a second-rate power, and it has been, than to destroy your government and destroy your Defense Department, your economy with tariffs and other things. And I fear that that may be where we're headed.
The ramifications we felt for decades to come. Dr. Zeke Emanuel, thank you so much for joining us this morning.